Hi, it's Jenny B, NSWOC. Today I wanted to talk about some of our foam dressings and a little bit about the new catalog that's been issued by the Ontario Health at Home. Now the catalog came out in September, and good old Dougie, he finally actually held somebody accountable for it, not just being outraged and then nothing happened. So it's been wonderful to actually see that there's been some progress with it. However, there's been quite a few challenges with it on the catalog because there's multiple dressings in the same category, and sometimes we're not using the right ones in the right ways. Also, they haven't still added some of the simpler foams that can actually make nursing practice quite a bit easier by utilizing these types of foams versus some of the other more expensive silicone foams. Now, there's no issue with the silicone foam. It's great because it does have some properties for people that are, have skin sensitivities. However, they don't really need to be used on everyone, and everyone's is overly sensitive to it. Again, and sometimes we do use them on patients that have very, very frail skin, and it can actually still pull a little bit. So there are some other options that we use, and we kind of forget sometimes, and they go by the wayside. Now, currently on the catalog there is some non-adherent foams, but they don't have any tape or any attachment. So I always joke with the nurses and community, because I live over here in the lap of luxury, because I have these fancy little foams. They're called Tegaderm, just literally a Tegaderm high performance foam. So the beauty of this is actually a non-adherent foam, meaning there's nothing on this side that is sticky. That's actually one of the big differences with the silicone foam. The silicone foam has tack all on this area. So when someone has a large skin tear, and again, we've actually pulled the flap over, it can actually cause us, when we remove that, to pull that skin flap off. So I still will do another video on skin tears, but I'm seeing this a little bit more frequently, and I want to show you one of the ways that I kind of go around that. So I want to use quite often is a non-adherent foam. So if you don't have these lovely fancy foams, which I know are not on the catalog currently, you can actually make this. How do I know this? Well, because I've been a MacGyver for many years too. So one of the foams that I use here, which is available on the catalog, although the Bison IBU is it is impregnated with some ibuprofen. So every centimeter square of this foam there is some ibuprofen in, which is really great to use topically when there's a lot of pain. It's actually also really great on a drier or a moderately exudating ischemic wound, because when you can control some of the pain, you can actually reduce some of the ischemic changes that are happening. So I use this for a multiple variety of things, but one of the big things, again, that can be used if you don't have any other type of foam, you can use this in place of, just the regular silicone foams that have full tack on the back. So what you really do want is a piece of non-adherent foam. I have the 4x8, so this is why it looks a little wonky here. So again, to be able to make a foam that looks like this, all I end up actually doing, because all nurses have access to, our favorite scissors that, I can pretty much cut paper dolls with, because I've been using them for 25 years and there's been nothing else, but they're, 18 cents. So those are the scissors that we get. But I also really like using one pair of scissors per patient. I really don't like putting them in, I really don't like sharing them amongst them, because again, that's how we can spread infections and whatnot, because alcohol doesn't fully just clean that off. So anyhow, what I'm doing is, I'm also a little finicky, so I cut my nice little circle here. So to be able to use this foam, so foam for the most part, we are told you're not supposed to put tape on the back. However, film dressing, which is a very thin layer, it's the same thing that we use for intravenous dressing. We actually get these in a box. This I have the 15 by 10 meters, where I think most of the catalogs have just the 10 centimeters. So sometimes you do have to use 2 layers, but you're just going to very thinly cross in the middle if you have to. But because I have this lovely large layer, I can actually use this film, and I'll be able to place the foam right in the middle. So when using only one layer, the film is actually semi-permeable, so it will allow for some fluid loss to come out the back of the foam, and it doesn't entrap it, because that's the main reason why they don't want us to actually put tape on the back of the foam, because that's how it works. It does allow for some of the fluid to evaporate off. So again, we know this from use of negative pressure therapy for many years, and how it's semi-permeable, as well as what the composition of film is anyhow. But then you can end up making this. Why is it so important to make this? Well, these dressings are fantastic to put on an elbow. Why? Because then the film all rolls up and you're able to get it conformed and get it sealed. These are actually waterproof. That's the other big piece. That silicone foams, yes, they tell us they're waterproof, but if there's any pucker in the silicone, and they do that quite easily, where when you put them on, even if they're put on flat, that we will get the edges when you go to put them on. See how they can pucker like this, and water can get into them, and then water fills up into this, and then it actually kind of renders our dressing useless. So it's one of the reasons why I still continue and will always continue to use the foams like these peel and stick Tegaderm foams, because again, I know I'm going to get a really good seal, especially if I'm on a foot, or I'm on areas that, you know, when they are showering, have the potential for pooling of fluid. So how I'm going to make this, again, I usually try to be nice and fancy too, and cut the shape of it. So if I'm making it a circle, I'm going to continue to make it a circle. And then these can be used just about anywhere. Again, that benefit of not having anything adhering to the wound, especially if their skin is sensitive to it, and or if you have the potential of pulling, I'm able to pull the back off. I place this in here, right in the middle. And these little pieces on this foam, these are actually just stabilizers. They're so that if I just pulled this off, the whole thing would kind of go up in a ball. So we have that with the backing on here, so it's, again, that it's stabilized. And then you're going to place it directly onto the patient, and you can mold it around, and then you'll end up taking the backing off. So again, if you don't have the fancy foams, I know I love them because they're peel and stick, and I can use them just about anywhere, and they're non-adherent, especially with a skin tear. They can stay on. Now again, this type of dressing, this can stay on actually up to a week. So again, if you do have a large skin tear, and again, I'm also with they're nice and padded, patients tend to like it. If I have this foam on for the week, and we are concerned about that thin prednisone-like skin where there's very little dermis and it's very paper-like, you do want to consider, is the film going to be the best choice? Again, if you're going to be able to leave it on a week, often it is. If you are going to have to change it more because it's highly exudating, it may not, and you may have to go to a silicone. But I did want to show you how to make these, because again, they're not something that's available Ontario-wide, but again, we do have them in a lot of acute care facilities because we're able to make those clinical decisions and choices ourselves. So hopefully that helps to clarify that. Again, we will do a little bit more on skin tears, but I want to get some of the basis of this because, again, skin tears happen quite a bit. And again, make them because you can. You have the stuff. All right, take care.